Good afternoon. I am Paul Zanatta, your webinar host and manager of Benetas's Centre for Cultural Diversity and Ageing. Welcome to our webinar, Lens on Standards, Communicating with Culturally Diverse Older People. Now I'd like to introduce our first speaker for today's webinar, Niki Stratigakos, who is the Account Manager Translating Interpreting Service, that is at TIS National. Niki is an experienced account manager within the Translating and Interpreting Service, TIS National. She manages the Commonwealth, non-government organisations and primary health network portfolio. TIS National is an interpreting service provided by the Department of Home Affairs for people with limited English proficiency and for agencies and businesses that need to communicate with their non-English speaking clients. TIS National's mission is to connect government, business and communities by providing credentialed, cost-effective and secure language services. TIS National has partnered with the Department of Health, Disability and Ageing to provide funded interpreting services for approved providers of government-subsidised aged care services who have clients from culturally and linguistically diverse backgrounds. Over to Niki.
The purpose of today's presentation is to discuss how TIS National Interpreting Services can assist aged care providers to abide by the Aged Care Act, which comes into effect on November 1, 2025. The Act highlights that it is vital that older persons are delivered information in a form and language which they understand and which gives them the ability to make informed choices and to make sure they can get the most out of their care and services. Multicultural access and equity policy is led by Home Affairs, but applies to all government departments and agencies. Australian government departments and agencies are responsible for applying the multicultural access equity policy commitments to their work. As Paul said, TIS National has partnered with the Department of Health, Disabilities and Ageing to provide funded interpreting services for approved providers of government subsidised aged care services who have clients from culturally and linguistically diverse backgrounds. TIS National sends invoices directly to the Department of Health, Disability and Ageing for payment, making TIS National interpreting services free for you and your clients. As of November 1, 2025, aged care providers that hold TIS National home care packages and short-term restorative care accounts will be able to continue to use these accounts to access TIS National interpreting services. TIS National will transition these accounts to support at home to align with the new Aged Care Act. You as providers are not required to take any action. You can continue to use the same client code that you currently hold and you're able to continue to make bookings as usual. According to the Department of Health, Disability and Ageing, the Commonwealth Home Support Program will transition to the new program no earlier than 1st of July 2027. For those that are not registered with TIS National, we request that you visit our website, tisnational.gov.au, and click on the registration form. The first 4 questions are to be answered as follows. Number 1, category, select Commonwealth Government Agency. Number 2, subcategory, select other Commonwealth Government Agency. Number 3, you are to state the name of your organisation as it appears on the My Aged Care website. And section 4, you are to state the type of service you require. If you're an aged care facility, home care package program provider, or Commonwealth Home Support Program. For any inquiries, you can email us at tispromo@homeaffairs.gov.au or call our client engagement team on 1300 655 820. We are able to provide you with some data that TIS National has multiple registered accounts, which are by the aged care providers. The residential aged care facilities accounts that we have registered with TIS National are 3,200. The home care packages are 890. The Commonwealth Home Support Program we have 463 registered accounts. We have been advised that there are 189,884 individuals in residential aged care facilities at the moment. Of those, 16,774 are individuals whose preferred language is a language other than English. With home care packages and Commonwealth Home Support Program, we have 275,486 individuals registered in this program, and 49,472 are those that prefer a language other than English. When we look at the interpreting services that were booked from residential aged care, we can see 733 bookings, telephone bookings, were made for the financial year of 24-25. 554 on-site bookings were made, and 37 video remote bookings were made, giving us a total of 2,151 hours of interpreting services. For Commonwealth Home Support Program, we had, for the financial year 24-25, we had 3,644 telephone bookings. We have 2,113 on-site bookings and 270 video remote bookings, giving us a grand total of 5,246. This graph gives us a clear indication and comparison between the residential aged care, which you see in blue, being 733, as we said, phone interpreting jobs, in comparison to the home care packages and Commonwealth Home Support Program, which is 3,644. On-site bookings for residential aged care is 554 in comparison to the home care packages and Commonwealth Home Support Program, which is 2,113. And finally, residential aged care homes have made 37 bookings in total in comparison to the 270. As you can see, there is room for improvement for aged care facilities to continue to use our services. Now, a little bit about TIS National. TIS National has a panel of over 2,700 independent contractor interpreters covering 150 languages. While dialects exist, communication with most non-English speakers is possible. TIS National offers a unique telephone service where non-English speakers can contact TIS National to be connected to services. TIS National is a well-established service with a long history of providing access to language services. TIS National delivers over 1.1 million interpreting services nationally via telephone, on-site, whether it be meaning that is in person, and video remote services. These services are delivered to local, state and federal government departments, medical and health practitioners, pharmacies, utility and telecommunication companies, emergency services, legal services, settlement and community services. TIS National has various forms of interpreting which you can connect with. We have our immediate interpreting phone line, which you can contact on 131450, and we have our online bookings, which can be done for telephone booking, on-site booking, and video remote booking. We also have ATIS, which is an automated voice-prompted immediate telephone interpreting service. ATIS allows you to connect to the phone interpreter without calling the TIS National Contact Centre. So, when should I use an immediate or ATIS telephone interpreter? When an immediate message needs to be delivered to a non-English speaker, or when a non-English speaker needs to deliver a message to you. Call TIS National's immediate service on 131450. We are open 24 hours a day, 7 days a week, 365 days a year. The operator will require your client code and language. The TIS National operator will connect you to an interpreter and also to your non-English speaker if they are not with you. Just provide the operator with the non-English speaker's phone number. The immediate telephone service should be used for a minimum of 15 minutes. The immediate and ATIS service can be used to communicate with residents when they are asked to take medication, get out of bed, get dressed, or even bathe. It can be used when the carer observes psychological or medical changes that need attention. When should I pre-book a telephone interpreter? on-site and video remote interpreter. Pre-book an interpreter when you have a scheduled appointment with a non-English speaker and when the assignment is complex and may take time. Pre-book an interpreter when you require specialist knowledge to be delivered to the non-English speaker or resident. Where the availability of an interpreter in a particular language is limited. Create connections and engage with TIS national interpreters when non-English speakers require assessments, medical practitioners, registered nurses, dietitians and nutritionists, psychiatrists or psychologists, occupational therapists, physiotherapists, or exercise physiologists, and even pastoral care. TIS National strongly encourages aged care facilities and aged care providers to make specialist appointments with interpreters to provide access and equity to non-English speakers. Every reasonable effort must be made to use credentialed interpreter before a family member, staff, or friend is asked to interpret or assist. It is not acceptable to ask children under 18 years of age to interpret for your non-English speaking clients. Some of the risks and impacts for both client and your organisation by using family or staff members include inappropriate decisions being made, misunderstandings, decisions made by someone other than the person receiving the service, conflict of interest, unintended harm or exposure to emotional distress. It actually compromises the accountability and standards of conduct compared to those provided by the credentialed interpreter. TIS National appoints interpreters who are credentialed by TIS National Accreditation Authority for translators and interpreters. NATI is the national standards and accreditation body for translators and interpreters in Australia. NATI's primary purpose is to strengthen inclusion and participation in Australian society by assisting in meeting its diverse and changing communication needs and expectations. TIS national interpreters are bound by the AUSIC Code of Ethics and Code of Conduct. Interpreters must conduct themselves professionally, provide confidentiality, competence, impartiality, accuracy, clarity of role boundaries, maintain professional relationships, professional development, and professional solidarity. We have credentialed levels according to various classification. The first highest priority being certified conference certified specialist, followed by certified, certified provisional, recognised practicing, and nil credentialed. Aged care providers have an important role to play to ensure interactions with non-English speaking clients and interpreters run smoothly. These include taking the lead and driving the conversation, clarifying information when you identify either the non-English speaking client or the interpreter may struggle to understand. Allow the interpreter to clarify information throughout the session. Find alternative ways to communicate that will make sense to the non-English speaking client in their own language. Be respectful and appreciate that interpreters can be impacted by exposure to sensitive topics by the behaviour and attitude of others. How can providers engage effectively with non-English speakers and interpreters? Always speak in the first person and speak directly to the non-English speaking client. Learn a few polite expressions like a simple hello or good morning will go a long way to improving your relationship. Speak slowly and don't shout. Speak in full sentences and don't stop in mid-sentence as this may put the information out of context. Don't repeat the same word over and over. Try alternative ways of explaining something in English so the non-English speaker can understand. Allow the interpreter to clarify information if necessary. Use clear language, short, simple sentences, but be careful not to patronize a non-English speaking client and pause often. Avoid jargon, slang, idioms, or proverbs, as this can cause misinterpretations. Allow interpreters a short break if the assignment is lengthy or complex in nature.
Thank you so much, Niki. Now going to our next speaker, introducing Poonam Daru, Program Director at Think HQ. With over 16 years of diverse experience, Poonam has worked across program management, learning and development, and the mental health sector. As Program Director for the Free Aged Care Translation Service on behalf of the Department of Health, Disability and Ageing, Poonam leads operations, client management, and stakeholder engagement. She has previously managed programs for Indo-Pacific clients, delivered training and development initiatives, and provided critical mental health services to the community via federal and state government funding. Her work is grounded in a master's in counselling psychology and supported by professional certifications in project management. Now handing over to Poonam Daru.
As the program director at Think HQ for the free translation service for aged care, I'm really pleased to be here today and speak to you all about this really important program and how it supports aged care providers in delivering inclusive, accessible care. Today, we're going to spend some time talking about, the overview of the program. We'll then look at the key difference between interpreting the translation, who's eligible to use this service. We'll also talk a little bit about what materials can and cannot be translated. I'll also briefly explain how we work with you and share a few tips on how to make the most of the service. I'll then end our conversation with our contact details so that you know where to get support and get started. So according to the 2021 census data, it reflected that more than 700,000 Australians who are aged 65 years and over come from multicultural backgrounds. We also know that English proficiency tends to be a bit lower amongst older people, which can make it harder for them to access and even understand important aged care information. So to address this, what the Australian Government Department of Health, Disability and Ageing have done is they've partnered with us at Think HQ to offer a free translation service for aged care providers. Now, what this service really does is it helps to ensure that people in your care get to receive the information they need about their aged care services in a language and format that they can understand. So you might ask yourself, why does, translating materials really matter? Now, translating materials is essential to make sure older people from multicultural backgrounds can really understand about their care and make sort of informed decisions about their needs. But it also tends to go a little bit, more than that. It's also about helping families and carers communicate more clearly and also provide them with the support to communicate. But also for providers as yourselves, offering translated material promotes that culturally safe, inclusive, and person-centered care, which is sort of a core part of the aged care quality standards. Now, before we go a little bit into the program itself, I thought we could just spend some time talking about the key difference between interpreting and translation. Earlier, Niki spoke about TIS National. Now, the translation program is often considered as being the same by a lot of people. So I thought I'll just take a moment to clarify the key difference between both the services. Now, interpreting sort of involves converting, your spoken communication from one language to another in real time. It helps people understand each other during conversations. Where in this service, the translation service focuses on converting your written documents, it could be audio, it could be video, into different languages. So that's the key difference. And that said, both interpreting and translation are essential when communicating effectively with culturally diverse individuals. So moving into eligibility, we'll spend some time talking about eligibility, organization, and material. Now, to access this free service, you are an Australian government subsidized aged care provider or peak body. Now, if you're a provider, you're potentially providing care under following programs. It could be your CHSP, HCP, which is eventually merging into your support for home. It could be your short-term restorative care. It could be respite care. It could even be care finders, potentially even the National Aboriginal and Torres Strait Islander flexible care programs. So we have all of these listed on our website. Some of the approved big bodies include, Aging Australia, COTA, PCAC, FECA, OPAN. So when we come to the contact details, you can access our website and you can access all this information in more detail there. Regarding eligible materials, now to use this free service, the materials that you want to get translated must meet a few key criteria. Firstly, you need to own the copyright. And what that really means is you have exclusive right to the copy and to distribute the material. Secondly, the materials should already exist, and you're just looking to get them translated into languages other than English. We wouldn't really be creating documents from scratch for you. Now, unfortunately, materials from other organizations are usually protected by their own copyright, and under this program will not be able to be translated without their permission. We'll now talk a little bit about what constitutes as eligible material and what doesn't. This is not an exhaustive list. This is just some of the most commonly requested materials we see. So it could be anything from welcome materials, such as information about, your organization. It could be fact sheets, any kind of forms and templates, such as service agreements, consent form, feedback form. It could also be surveys, in-facility signage or communication cards, any sort of disaster plan information, and of course, audio and video messaging that you feel would be important. Just a note on this is that the translation service can only be accountable, for the accuracy of the materials translation. It is the aged care provider's responsibility to remain accountable when it comes to meeting your legislative obligations through, the original English language documents. Regarding materials that cannot be translated, personal or individual content. Now, this could be, for example, individual care plan. It could be an outstanding bill, payment, a reminder, marketing material. Primary for the purpose of promotion or pitching for new clients would be considered ineligible. Any sort of, frequently changing material. Now, this could be newsletters, it could be menus, it could be meeting minutes. Also, any information that's on the Commission's website or on the Department of Health, Disability and Aging's website. Now, they do have an exhaustive list of resources that are already translated. So if for any reason it is a department resource, we will check with our stakeholder to see if it's already available. If not, we could potentially even put in a request. So we will essentially work with you on that. So we've spent some time talking about eligibility. So we've looked at eligibility of organization and materials. We'll now talk briefly about the process and a few tips to make this service a bit more helpful. So this, in a nutshell, is our process. To get started, essentially, what you would do is you would submit a request for translation by filling out an online form that's available on our website or by giving us a call. What happens next is within 24 hours, someone from our team will contact you via email and telephone call. And here we will check with you about, what is it that you want to get translated? What is the type of material? Who is the audience? What is the purpose? How many languages are you after? Would they benefit from audio and video as well? And what is your preferred format? Next, we will assess if your request sort of meets our eligibility criteria, which we have just discussed. We then move into the translation and design phase. Here, the translation work is carried out by NATI accredited translators, and a second translator sort of reviews the content for quality. And finally, once the scope and the design of the translation has been completed, you will then receive an email with a link to, download your resources. A commonly asked question here is around timelines. Now, the turnaround time really depends on complexity of the material and the rareness of the language, but that's something that we would again work with you, and we're open to seeing what works best for you as well. And I guess just lastly, in terms of how can you make the best use of the free aged care translation service? It's really helpful if you spend some time to, think about your translation needs for the upcoming period. We know that 1st November is just around the corner. We are conscious that a lot of providers would have to update or create new documents. So putting in some time and thinking about all of the resources that would potentially need to get updated or translated, rather than just that one single document. It's also secondly helpful to identify, who are your beneficiaries? How are they going to be impacted by this material? Would they be, would they prefer communication cards? Would they prefer looking at a hard copy and listening to say, an audio script? Would they benefit through the use of a video, for example? So maybe spending some time thinking about your beneficiaries and identifying who they are. Gathering all of your English materials. Now, what this refers to is essentially your working or editable files or your design files. If you're unsure of what that means, contacting someone in your marketing team, or if those are not available, then letting us know and we can work with you on that. And finally, giving us a call or an email, and we're here to provide you with advice and help you think about sort of what would work best for the people in your care. So thank you. That brings us to the end. If you have any questions or you're ready to get started, please feel free to reach out to us. You can visit us at diversityagedcare.health.gov.au, or you can even send us an email at diversityagedcare@health.gov.au. Alternatively, you can give us a call on 1-800-271-034. We're here to support you and make sure you get the most of this free translation service. Thank you so much, everyone. Over to you, Paul.
Thank you so much, Poonam. Now going to our next speaker, I would like to introduce Gladys Maseko. Gladys is the General Manager of Residential Services for MiCare. Gladys oversees the operations of MiCare's residential aged care homes. MiCare supports people from diverse communities and plays a key role in ensuring their individual needs and wishes are well understood, respected, and met. Gladys volunteers in the Zimbabweans in Australia Association community programs. She's a former chairperson and enjoys supporting various community and cultural programs. She's also a published author whose passion for aged care led her into writing her first book, The Journey of an Aching Heart Through a New Leaf. Welcome and thank you. Over to you, Gladys.
I'll start by a brief background of MiCare. MiCare supports diverse communities. Our services include residential care homes, home care, retirement villages, social support services, migrant services. The Mi in MiCare stands for migrant care, but we have extended to more diverse communities. As part of the strengthened standards, Standard 1, the individual, Outcome 1.1.2b, requires aged care providers to identify and understand the individual communication needs and preferences of the older person. This sounds very simple and easily achievable. I would say it's one of the outcomes when we went through the initial draft that we sort of ticked confidently to say we are meeting this. Because our everyday nursing and care includes obtaining information upon admission on the languages that the new residents or clients speak, and then we establish other communication needs that they require. The approaches that were in place, we met the communication needs through verbal communication, the assistive devices, ensuring that they're wearing their hearing aids, their eyeglasses. If there's requirement for nonverbal communication, whether it's nonverbal signs, cue cards, body language, use of Google Translate app for non-formal conversations, reaching out to translating services like the TIS National for formal communications. MiCare ensures strategic recruitment. We hire staff who speak the different languages that our residents or clients speak so that we can meet their communication needs. And we also have memorandum of understandings with different community groups like the Latin American Community Association of Queensland, who support us with Spanish-speaking staff to support our Spanish residents. We analyzed the strengthened standards along other reforms. The strengthened standards first draft came in on the 1st of December in 2023, and we've continued along this journey to date. MiCare is an organization that has a culture of encouraging all staff to analyze current practice, think outside the box, challenge, and come up with best practice initiatives to attain the desired improvements. We have a best practice committee led by the Clinical Safety and Best Practice Manager. She works with clinical support coordinators and with our residential managers and staff to achieve the identified or required improvements. When they looked closely at this requirement, the Clinical Safety and Best Practice Committee, as well as the Diversity and Inclusion Advisor, they dived deeper into our practice to establish if indeed we meet the communication needs of cultural and linguistically diverse residents that we look after. The results were surprisingly partly, and more work needed to be done to meet the desired outcomes. Their findings indicated that most languages spoken by CULT residents have dialects that may sound different, and this can lead to specific or individual communication needs or preferences not being met. So the strategies or approaches that were in place, external services available, some translating apps, mainly cater for the main languages and do not have specific dialects derived from or associated with those languages. Some examples that I have for today: the Spanish language. Castilian Spanish is spoken nationwide in Spain, but there are several regional dialects. There are also several and different Spanish dialects in South American countries. For example, the Rio Platense, Andean, Amazonic, Chilean, Colombian, and Caribbean Spanish, which is found in some parts of Colombia, Caribbean islands, and Venezuela. Looking at the Dutch language, the research indicated that there are several Dutch dialects. Despite the differences, people from different dialects generally understand one another. There are, however, some vocabulary and pronunciation differences that may cause temporary confusion. This was confirmed by some of our residents as they compared Dutch dialects between the Northern and Southern Holland. So the question was, what does this temporary confusion mean when some of the people that we support have different degrees of cognitive impairment? The third and last example I'm using is the Greek language. There are several dialects of modern Greek, including the Demotic, Cypriot, Pontic, Sogonian, and Katarevusa Greek. When we fail to understand those dialects, and we also support some people that are living with dementia, and as it progresses, they resort back to their mother languages and cope with some of these dialects that we are talking about. So when they're trying to communicate with us and we're failing to understand what they are communicating, it can cause frustration on them, not wanting to interact or participate in conversations, forced social isolation. They may be anxious, they lose their confidence. This leads to poor quality of life and well-being, and they can incorrectly be labeled as confused, agitated, or even yelling as they attempt to repeatedly communicate their needs in a language or dialect that staff or friends do not understand. So we had to look into what improvements needed to be done. Then we looked at what we were doing and what could we do better. So in terms of recruitment, no longer just asking the question to staff, what other languages do you speak? But then going into the specific dialects as well. Same with our volunteers. We have a volunteer coordinators team. When we reach out to them to request for volunteers, we're being more specific on the language, the culture, the dialects that they speak, or even just the specific parts of the countries that they come from, and match them with people that they will indeed understand each other. The Staff Resident Buddy Program is one of the best practice programs that the organization embarked on to align with the reforms and the strengthened standards. Specifically on this one, it was Standard 1, the individual, where staff are paired with buddy residents, and then they're given time, about 6 weeks, to get to know each other. And after 6 weeks, there's a presentation day where the staff and their buddy resident present to fellow staff members who work in the same household, so that at the end of the day, every staff member knows the residents well. They complete case studies during those 6 weeks. So the case studies were also reviewed, and the questions around culture were improved to specify the language and the dialects, and also finding out whether their communication needs are being met. What we found is we look at how are we meeting their communication needs, but when you ask or liaise with them and find out what their communication needs are, they want to be able to interact in that dialect or language versus the provider ensuring that we are getting what we want or we need to be able to support them. What about just sitting and having conversations, the companionship that they will be able to interact in those languages? The lifestyle and activity survey was also reviewed, and they created a new one, Your Life, Your Way, where the cultural part also has speaking and hearing my language as one of the cultural activities. So if this is one of the activities that the resident wants, how are we going to meet that for the non-common dialects? We have a residence and transition supervisor who interviews the families and the residents after a couple of weeks of admission, just to see how they are settling in. And that question around communication needs is being addressed. Our best practice committee continues to promote a person-led culture versus just person-centeredness, and they are continuing deep dives to ensure best practice across all aspects. Feel free to contact me or for further conversations and to know what you are doing differently in your organizations. Thank you.
For the first question, in fact, there's two questions here that relate to community health as a hospital and also Sydney healthcare interpreter services. So the question in a nutshell, and this is very much targeted to yourself, Niki, at TIS, is can health services use the translating and interpreting services for free, or must they use another service, or are they able to use it for free if it is with an aged care client in an aged care setting?
If we have a resident that requires any allied health professional within the residential aged care, a booking can be made with that for that allied health professional with the aged care facilities client code. That will make it a free service for the aged care facility, the resident, and the allied health professional. And that is the new thing that we're encouraging, which we have come to believe that not very many aged care facilities are aware. Use those psychologists, those psychiatrists, the physiotherapists, the nutritionists, the mental health services that you require. So definitely when you are in the aged care facility and you require allied health professional, it is a free service. Additionally, for home care packages or Commonwealth home programs, you can have the physiotherapists, psychologists as well, using the client code of the provider, making it again a free service for the home care package recipient, the provider, and the allied health professional. That way, we encourage greater use and better access and equity to those non-English speakers accessing services that they may not have thought possible.
Are people on the transitional aged care program, that's the joint program between aged care and acute health, are they able to use TIS?
If you have a registered account with TIS National, which means that you have access to free interpreting service, I am prepared to take a look at it. I'm not too sure about that second part you mentioned, Paul.
People who are on a transitional care package, for example, either transitional care delivered in a bed-based setting or in a community-based setting?
Again, they should have access to the allied health services free of charge when they use their provider's client code. We do have lots of allied health professionals who try to register, and as soon as they tell us we need to enter, an aged care home or a Commonwealth Home Support Program or home care package, we advise them to contact the provider and to make the booking on their behalf, to make it free.
We have another eligibility question here. Can Think HQ work with hospitals who provide rehabilitation support to older people in the community or inpatient setting?
Under the scope of the free translation aged care service, Think HQ cannot work directly with the hospitals. However, Think HQ's business as usual language services team can definitely provide this support. So our in-house team can certainly engage directly with the hospitals that provide rehabilitation and support services to older people. We work with a network of over 250 NATI accredited translators in over 70 languages. So if this is something that you would like to explore, you can definitely reach out to us via our website, which is think-hq.com.au.
And Poonam, just for clarifying, someone has commented, we were told there is an additional charge for using the aged care translation service. Is it a fully free service?
It is a fully free service. Again, this service is for the translation of documents and not necessarily interpreting that Niki would be talking about. Yeah, but for documents, for audio, for video, it's completely free. You do not have to pay for anything.
A question for Gladys from an attendee. Gladys, could you please elaborate on your recruitment strategies? We find it challenging to recruit personal care assistants or personal care workers from European backgrounds to provide care for many older European residents.
Thank you for that question. So what we do when we are advertising, we can be specific if we are looking at a specific language that we want or we need. We will be saying, especially for one-to-one, I'll give an example of the home care clients. We would be specific to say a Greek speaking. So that's the starting point. Then we know all the applicants are Greek speaking before we even conduct the interview. So we're specific on the language that we are looking for. And also using your other recruitment strategies or the organizations, as I said, it's good to link with the community organizations if there's any around your area or you broader, wider area that from those cultures or language, they will work with you and be able to support, because their community, young and old, is made up of people that can speak those languages. So it is quite helpful. They will support you as well.
Thank you, Gladys. Just a further question, Gladys. What minimum percentage of bilingual client or resident-facing staff would you consider as critical to support a multicultural service model?
It will depend on firstly the cohort of the residents that you have. I think what would be important is to make sure for the most common languages, you have got staff, for example, in each shift that will be able to support, that can speak the language. So depending again on the size of the organization. So if you're quite multi-cultural or you have a number of languages within, you would want to make sure that there's staff that can speak the language. In some setups, you've got dedicated households with people or cohort of residents from that same culture or that speak that same language. Then your rostering and allocation will make sure that if it's a Spanish household or a Dutch household, you have staff in those specific households. But as I said, when recruiting, if it's bilingual staff, you just need to know what languages do they speak. And also looking at your percentages, you do not want to you also want to make sure that we cater for everyone, even the only one person that speaks a specific language in the facility. But there's no set of fixed or legislated number. But I think in rostering the managers, what they just need to make sure is the Spanish household is catered for across all shifts. The Greek household is catered in all shifts. But when you look at organizations or homes that have predominantly one or just two set languages, they will have higher percentages of staff because it's predominantly maybe Greek or Spanish in that setup.
Gladys, you're very popular today for questions. Is being specific in advertising for a language or an ethnicity not a risk of being accused of discrimination? So what's being asked is, does this create a discrimination risk?
No, not at all. Because if we're going to be person-centered and if we're going to say we're meeting the specific needs of the individual, that individual, if their need is a support worker that provides companionship, they want someone that they'll be interacting with, that they'll be chatting with, that they'll visit places with. So they will be specific about what they need. So if that person is Italian speaking, yes, she will express what she needs, and she needs an Italian speaking support worker that she'll be able to interact with so that she can enjoy the service that is being provided to her. That's why I spoke about the person-led care or lifestyle. They are leading the care. They are directing what it is that they want. So if that is what they want, that is what we will look for.
You're not going to be in breach of discrimination if that's the specific skills that you require to deliver the care for the residents or the clients of the community care service. Gladys, just a further question for clarification we have here is you've used the terms person-led culture and person-centred. Are you using those with a sense of difference between the two terms, or is it pretty interchangeable?
They are similar. The differences is in person-centered. We're focusing the care on the person, but the healthcare providers can make decisions for the person. So the person is involved versus in person-led care. Not only are they involved, but they will make the final decision. They will be the ones making that decision to say, thank you for the advice and everything, but this is what I want. Versus person-centered care, we're focusing on the person, but the experts may then decide to say, this is what we'll do. They're involving them, but we are bound to also make decisions for them.
Thank you. And thank you for making that clarification, Gladys. That's a very, very important clarification. And finally, I have a question for Poonam. What type of documents are you finding most commonly that you are translating for aged care providers at the moment, Poonam?
At the moment, everything related to support at home. So a lot of a lot of fact sheets, a lot of what are the key changes that are coming across, what's really going to transition and change from 1 November onwards. But barring the topic support at home, which is very popular at the moment, we often see a lot of service agreements. We see a lot of fact sheets and feedback forms. So that could be anything from feedback, consent, surveys, complaints. These seem to be the top sort of key genres of materials that we get. Having said that, there's no sort of limit when it comes to translating. So feel free to send us anything you need.
Thank you, everyone, for coming today. Thank you for coming to our October webinar from the Centre for Cultural Diversity in Ageing.